Good day, this is Abdurrahman Habib. I'm a sixth-year medical student at King Saud bin Abdulaziz University for Health Sciences, and I'll be presenting our study entitled as The Satisfaction of Surgery Trainees with the Educational Environment in the Saudi General Surgery Training Program. What matters to them? This is our team led by Dr. Mohammed Shaheen. Surgical residents are exposed to a highly stressful training environment and lifestyle, which attribute to the increased rates of burnout and attrition. The Saudi General Surgery Training Program has been evolving to improve the residents' experience, but unfortunately, the available studies reveal low levels of satisfaction as well as well-being. The most recent study tackling this issue was done in the eastern region about 4 years ago, and it only looked at the resident satisfaction with different aspects of training program. So we decided not to rely on the old data and to re-evaluate the current situation in a more comprehensive scope and discovering the culprit of the low satisfaction and high burnout to direct educational leaders such as the Saudi Commission for Health Specialties into the stem of this issue. So we aim to assess the level of burnout, satisfaction of different aspects of the training program, and the well-being of the general surgery residents with the local training program, and to gain further insight about the residents' perspective on the current situation through conducting semi-structured interviews. For the methods, this was a sequential explanatory mixed study. We started by collecting quantitative data through distributing online survey to all general surgery residents throughout the kingdom. Then we gathered the qualitative data via virtually interviewing 8 residents. The quantitative data were analyzed using SPSS, and the qualitative data were thematically analyzed by 3 independent reviewers using DDoS software. Through the online survey, we gathered the demographics data, burnout-related data using the validated abbreviated version of Maslach burnout inventory, and the satisfaction assessment via 5-point Likert scale. We had a total of 71 responses. Only 47 were analyzed as other responses were not completed. 51% were males, and the mean age was 27 years. 26 residents were junior and the rest were senior. Almost half of the participants have considered switching off general surgery training. When speaking about burnout, we can objectively say residents do have burnout. They have moderate to high rates of burnout based on what we found on Maslach burnout scale. And when speaking about their training, we can objectively say that they are not satisfied with their training. The 5-point Likert scale reflects dissatisfaction with all aspects, especially with the research experience and academic environment. The only exception was case volume. So, what are the reasons for burnout and dissatisfaction? Through the interviews, residents identified lack of appropriate hands-on experience, suboptimal teaching with unmotivated surgeons or educators, and medico-legal restraints as the major themes of dissatisfaction. To conclude, the findings showed dissatisfaction as well as concerning level of burnout. The heart of this issue stemmed from suboptimal educational delivery inside and outside the OR and lack of hands-on experience rather than lack of resources and cases exposure. Although this might be difficult to tackle, simulated training should be encouraged to partially fix this issue.